Automated deep learning analysis of abdominal CT images produces a more precise measurement of body composition and predicts major cardiovascular events, such as heart attack and stroke, better than overall weight or body mass index, BMI, according to a study presented today at the annual meeting. Established cardiovascular risk models rely on factors like weight and BMI that are crude surrogates of body composition, said Kirti Magudia, MD, Ph.D., an abdominal imaging and ultrasound fellow at the University of California, San Francisco. It's well established that people with the same BMI can have markedly different proportions of muscle and fat. These differences are important for a variety of health outcomes. Unlike BMI, which is based on height and weight, a single axial CT slice of the abdomen visualizes the volume of subcutaneous fat area, visceral fat area and skeletal muscle area. However, manually measuring these individual areas is time-intensive and costly. Abdominal CT scans that are routinely performed provide a more granular way of looking at body composition, but we're not currently taking advantage of it, Dr. Magudia said. The researchers identified 128 patients who were free of major cardiovascular and cancer diagnoses at the time of imaging. Mean age of the patients was 52 years, and 57% of patients were women. The researchers selected the L3 CT slice from the third lumbar spine vertebra, and calculated body composition areas for each patient. Patients were then divided into 4 quartiles based on the normalized values of subcutaneous fat area, visceral fat area and skeletal muscle area. In this retrospective study, it was determined which of these 128 patients had a myocardial infarction, heart attack, or stroke within 5 years after their index abdominal CT scan. The researchers found 560 myocardial infarctions and 938 strokes occurred in this study group. Statistical analysis demonstrated that visceral fat area was independently associated with future heart attack and stroke. BMI was not associated with heart attack or stroke. The group of patients with the highest proportion of visceral fat area were more likely to have a heart attack, even when adjusted for known cardiovascular risk factors, said Dr. Magudia. Please support my channel to grow by pressing subscribe button and the bell icon. We will notify you technological news. Thank you.